Hey everyone, thanks so much for joining me on the Slice of Healthcare podcast. I'm your host, Jared Taylor. I'm here today with the founder of Augmedix, Ian Shakil. Ian, how are you today?
Doing great. Great to be here, Jared.
Yeah, I'm excited. Excited to have you on to talk a little bit about yourself and Augmedix. I think we should dive right into it. If you could tell the audience a little bit about your background, then we'll start diving into Augmedix a little more.
Sure thing. Well, my background, I grew up in healthcare, mostly in the world of medical devices and heart valves. Left industry to go to Stanford for grad school. That's kind of where I caught the startup bug, like seemingly everyone else does. And right out of grad school in 2012, I had an amazing opportunity to meet all the right people and be inspired, and found this company, Augmedix. We founded the company back in 2012 with a mission to rehumanize the doctor-patient interaction. And from me and my co-founder way back then to today, a decade later, we've been rocking and rolling and growing the company ever since. We now have well over 1,000 folks working for us, and just, as you know, recently listed onto NASDAQ. So it's been an awesome journey, but we're still just getting started.
Congratulations about that too. I was pretty psyched. I was telling you when we were talking the other day that someone shot me over your S1s, like, review this for me, let me know what you think. And then literally a couple weeks later, you and I are talking. So it's exciting kind of to go full circle here.
Hopefully not just bedtime, go to sleep reading, but I found something interesting.
You and I talked about this on the last time we spoke. Selfishly, an S1 is like awesome. It's the best way. I mean, it's probably not fun for you to have to help put it together, but for just you can learn so much about a company, the ins and outs, and not just the company, the industry. We need to be preaching, read the S1s more and more and more to even the youngest of people. But
there's a lot of
yeah. But hey, I'm really excited to have you on. Can you give us quickly? I always ask every guest that comes on here, can you give us the why, how, what of Augmedix? You kind of already gave us kind of a little bit of like how things came to be and what the initial mission was, but I'd love to have that, and then we can go into some of the questions.
You got it. So we exist to tackle basically the biggest pain point in the lives of doctors. And that's the fact that a doctor spends basically hours every day on the computer, on the EHR, typing and clicking away, and not focusing on patient care. Doctors did not go to medical school to be spending their lives away in this way. We as patients find this to be miserable. Health system management, it's a tragedy for everyone for this sort of EHR dilemma and burnout to be just as pervasive as it is. And what Augmedix does is we solve that problem. Basically, what we do is we put technology at the point of care. We give doctors either phone kits or Google Glass. So our technology is then present in those doctor-patient conversations. And then what we do is we ambiently convert natural doctor-patient conversation into EHR notes better and faster than what the doctor would do on their own, thusly saving the doctor 2+ hours a day, making them really happy and retained and not burned out, producing a better experience for the patient, and producing documentation that is better in every respect. All they got to do is run our device, turn on our service, we'll handle the notes. So you're probably wondering how does that work? And so what's actually going on is we're live streaming the visit, the audio and video, to our platform, where we have a combination of human expertise and critically automation technology, processing the conversation, producing the notes where they belong in the EHR. So specifically, we employ what we call MDSs, or medical data specialists. But these folks are nothing like scribes in the traditional sort. They're very much supercharged with an array of speech recognition technologies that are diarizing and transcribing and making first attempts, and making linkages with our NLP note builder, which is expanding the note faster than any scribe could conceivably type. So with the placement of both our automation technology and our MDSs, we're able to provide a truly ambient solution, also one that is scalable and one that is efficient. So all the doctor has to do at the end of the day or throughout the day is look at the EHR, the note is there, they can click confirm, make an edit or two, and voila, they save a third of their day or more.
Thank you for sharing. I always have to ask that. I love to have it on record exactly how that structure's in place. It's not my structure. I took it from Simon Sinek. People don't buy what you do, they buy why you do it, and kind of follow that why, how, what structure. And that's how you get people to be really interested in what you're doing. Something I want to talk about, because you and I were laughing about this before we started recording, is you went public originally on the OTC. And you went public basically through a reverse merger, which, as we were talking about, is you always hear about like SPACs and just a traditional IPO. You don't hear as much about people using the reverse merger strategy. So can you talk a little bit about kind of how that went down, and then kind of tie that into, you recently got uplisted to NASDAQ, which is huge. Congrats. But kind of tie that in, because I think it presents a cool opportunity for those to realize there's more than just the SPAC route or the IPO route. There's also this strategy as well.
Yeah, for sure. So about 1 year ago, we went public by way of reverse merger, which is kind of similar to a SPAC in some ways, but not a SPAC, to be technically precise. In doing so, we raised approximately $25 million in fresh capital, and we're listed as AUGX on the OTC. But we positioned this as really a two-step process. And step two was then to uplist onto NASDAQ. This uplisting NASDAQ process occurred approximately 1 month ago. In that transaction, we took in another incremental approximately $40 million in fresh capital. So through that two-step process, we're now a big boy, NASDAQ listed company under AUGX, and we're all really excited about that. And with that capital in hand, we're really deploying it for two major endeavors. One is to really hyper accelerate growth. We love where we are in terms of our product market fit and our unit economics. We're really wanting to put the pedal in the metal and grow our commercial organization and our commercial footprint in general. And two, we've made incredible advancements with our automation and technology roadmap, and we're going to accelerate that. So those are the two main uses of capital with the fresh funding we just recently received.
Yeah, congratulations. Again, that's huge. That was actually going to be my next question. Where's kind of the use of the new capital going?
Yeah, I mean, to elaborate that, on what I just said, we're really building out our sales team and our account management team and our partnership team to further accelerate our sales footprint. Today, we have an incredible commercial footprint. More than a dozen of the nation's leading health systems are on us and loving and growing and expanding. Those include the likes of Sutter and Dignity and CHI and US Oncology and many, many others. We like that, and we want to keep adding to the list and accelerate that adding. So that's the number one use of funds. We think that we've reached the tipping point in unit economics where it makes sense to put fuel into the fire in a very big way. And two, as I mentioned previously, in some ways we're a hybrid AI company, right? We have humans in the loop. We have a bunch of automation as well, and they work hand in hand in making an ambient note creation possible. We want to accelerate that automation process. It will improve scalability, it will improve efficiency, it will improve gross margins and unit economics for the company. And we believe we're well positioned to do that and lead in that. So we have a very large and capable engineering and IT effort, and we're adding to that to accelerate our dominance on the automation roadmap there.
Thanks so much for sharing. Appreciate that. And I want to kind of go back to an earlier comment you made, and I know you talked a little bit about it, but my next question has to do about it, is you kind of define, I feel like you're a part of multiple spaces, but in your eyes, you believe you're part of this, what's called the ambient documentation space. Can you talk us through basically what you see the future of that space being? And then part two of that question, how does Augmedix play a role in that future of that space?
Yeah, if I take a step back, I really think of there as being kind of a documentation spectrum. On one end of the spectrum, you've got in-person on-site, like scribes. Literally, sometimes doctors and patients are having conversations and there's a third person in the room, computer up, typing, charting, clicking, documenting, scribing for the doctor. And what we're seeing is, though that can be incredibly helpful for the doctor, it is not at all scalable or efficient, COVID friendly, and that practice is fading away. We're kind of coming in on this new era where we're able to provide a similar level of service, but a lot more consistency technology, and we're able to do so remotely. And that is the space we call sort of ambient documentation. And ambient documentation stands in contrast to dictation or transcription. You may be aware of some doctors that use Dragon, right? And maybe they'll see a patient, and then after that visit, they'll spend 5 minutes dictating word for word entire sections of the note, or maybe they'll spend 2 hours at the end of the day doing their dictations and transcriptions. That's Dragon. That's single party dictation. We're not like that. Ambient documentation. It basically, the key differentiator is we create the note from the organic conversation. There's no additional time needed, verbatim dictating word for wording at the end of the day or between visits. We create the note from what's said in the visit, and then you're done. So radically more benefit, radically more time savings for the doctor users to use an ambient solution. And if you want, I can kind of jump in to the ambient space. We really kind of break it down into real-time solutions and asynchronous non-real-time solutions. I think what differentiates Augmedix is that we're the kings of real-time interactive. We, and uniquely we, have cracked the code and have a scalable solution to provide a real-time service where your notes are created literally as you go, and a bunch of interactive capabilities are made possible by being real-time and interactive in the way that we are. There's another space, the non-real-time asynchronous space, where we have a bunch of fast followers popping up and a lot of competitors, and that's probably a good sign. We also have an offering in the asynchronous non-real-time space. We call that Augmedix Notes. It's flexible, it's more affordable. And what makes Augmedix really unique is that we can offer both. So for a large doctor group or health system, we can say, these doctors would be a great fit for our real-time solution, Augmedix Live. Let's rock and roll with that. These doctors over there are great fits for Augmedix Notes. Let's put them on our asynchronous solution. And we can provide the full suite of solutions to meet every need. And really, we're uniquely positioned to do that. Others really, for the most part, cannot play in that real-time space like we can.
Thank you so much for sharing, by the way. Yeah, that was a great breakdown of both kind of what you see the future of the space is and kind of how Augmedix plays a huge role in the future of the space, right? So really appreciate that breakdown from you. Last question for you, what's next for Augmedix? Obviously, fresh off being uplisted on the NASDAQ, you have some new capital, you're investing it in all the right areas, but what's next through your lens for Augmedix? Yeah,
you put your hat on. You're going to see a lot of news from us on relentless automation and more advancements with AI, which has so many benefits, as I previously mentioned. And you're going to see a lot more broadening of what it is that we do. A lot of people really think that, hey, what we do is we do the note. And yeah, doing the core documentation in the note is very important. But we do more than that. We do orders and referrals and letters and reminders and soon a whole lot of additional services as well, all made possible by our unique real-time presence at the point of care.
Yeah, I'm really excited to keep seeing these updates and everything. Should be a lot of fun. And I hope we can have you on again real soon to kind of maybe talk through some of these updates and things that are happening in the space. But again, really appreciate you coming on and can't wait to have you on again real soon.
You got it. Thanks, Jared.